Proton therapy is an exciting new technology here at Beaumont Health.
One of the most innovative and revolutionary treatments for patients with cancer.
It's great to know that we finally have something physically here on campus that's operational and treating patients as we speak.
It took over 10 years for us to get to the day that we could treat our first patient.
The construction of the Beaumont Proton Therapy Center was extremely rewarding. We were able to bring together a team of designers, engineers, physicists, companies to help us build the center. From Belgium, where our cyclotron and the gantry that you see behind me was built.
The actual gantry itself required the largest crane in Michigan to be brought here on campus to lift 100 tons into place. It also has the second cyclotron that is a smaller version of the IBA, first in the US, second in the world installed.
So we've been able to recruit a team of talent really from around the world to make this one of the best proton therapy centers anywhere.
The Beaumont Royal Oak campus is a nationally recognized and ranked academic medical center. We really pride ourselves in our commitment to providing outstanding clinical care. We're one of 25 centers in the United States that are offering this therapy, the first in the state of Michigan to provide it.
Patients who had to seek those treatments had to leave their families and go far distances to stay for 5 to 7 weeks.
And I think it's that commitment that really challenges us and motivates us to bring for patients with cancer the most sophisticated, innovative therapies where they don't have to travel outside of their area, outside of their communities, outside of their state, that they can come right here in Southeast Michigan and receive revolutionary therapy that could help eradicate their cancer and help them get back to their normal lives.
We decided to invest in this great technology because of its importance to patients. When X-rays are used to treat a patient, those X-rays go all the way through the patient. What protons do is they go into patients and stop. Our machine here at Beaumont has the latest technology. With intensity modulated protons, we can actually put dose exactly where we want it. We can build dose distributions very much like a 3D printer does, layer by layer, providing maximum tumor dose while minimizing the dose to adjacent normal healthy tissues.
That really makes this campus a destination site for so many therapies and for so many treatments.
Proton therapy is ideal for many patients with cancer. In particular, it is good for patients with brain tumors, with left-sided breast cancers, where we'll be able to essentially eliminate the dose to the heart that sits right underneath the breast. It'll be wonderful for abdominal tumors. We'll be able to get more dose to pancreatic cancers than we could ever give with X-rays alone.
The result of that then is that patients, particularly pediatric patients whose longevity is many, many years post their treatment,
have the greatest risk of late side effects. And so protons are really ideal for that group of patients. We want to make sure that the doses to the normal healthy tissues in those patients are as low as possible.
We receive multiple phone calls daily from not only patients, but other community members who are interested in taking tours of the center and the facility and learning more about how they could advocate for patients to use this type of therapy for their cancers.
Particularly for patients with cancer, there's a fight there, and they don't settle. They want to pursue every option and every avenue that will empower them to really combat their disease.
I've done some research about the process and everything, and I'm convinced that it is the best. You go through life and you go different places, you go through different hospitals and everything, and you're treated differently on each one of them. But at no time have we ever been treated as well as we have here at Beaumont. We just can't say enough about it.
And so, though it took us 10 years to get here, it was worth the time and the effort. We will be their partners in fighting this disease in a very unique and special way, and that's what we're here to do.